The Director General of NCDC, Dr. Ifedayo Adetifa, emphasizes that the media plays a vital role in disseminating information to every corner of the country, whether through traditional or social media, otherwise known as new media.
We expect it to succeed, and if it succeeds, then it's easy to make a case.
Speaking further, Adetifa described the danger of the infodemic as an excessive amount of incorrect information that spreads rapidly, particularly through social media.
Colleagues also are equipped to do their homework. Okay, you also need to do your homework for many of the public health events you'll be reporting on. So you don't always have to depend on what we say. There's also independent sources of information that you use to either compare, verify, or triangulate in terms of confirming veracity of what we say. Okay, so this is why I say we are unfortunately seeing the consequences of historical poor vaccination coverage. As you know, there have been more recent efforts to make sure that vaccination coverage improves, and I think we are seeing a bit of the evidence, because infants or children under 2 who have higher coverage these days are less affected by the ongoing outbreak.
While addressing the media's focus on diphtheria, Adetifa has directed attention to the NCDC's website, which provides the most up-to-date information on the situation. It revealed that over 70% of the reported cases occur in children aged 2 to 14 years, while more than 82% of the confirmed cases are among unvaccinated.
Cases, the numbers I say you can confirm from the website. I think the important thing to note is what I've said earlier. More than 70% of the cases are occurring in people that are aged 2 to 14 years old. Okay? Over 82% of confirmed cases are unvaccinated. Okay? Now, for people who are 2 to 14 years old that are bearing the brunt of this disease now, what this means is that anything from 2 to 14 years ago, they did not make use of opportunities to get vaccinated. Because if you are vaccinated according to our immunization schedule and you receive your 3 doses of the pentavalent vaccine, which contains anti-diphtheria toxin at 6, 10, and 14 weeks, then you are protected against diphtheria.
Also, the Deputy Director of Risk Assessment and Communication of the Federal Ministry of Agriculture and Rural Development, Dr. Dupe Hambolu, emphasizes the important role journalists play in disseminating vital information to the public.
It is a collective responsibility of all stakeholders, including health-focused media practitioners. The health-focused media practitioners has a great role to play in informing the public about public health-related events, disease outbreak prevention, and control measures in Nigeria.
Importance of investigative reporting and data confirmation that will empower journalists to produce compelling disease outbreak stories and contribute to the development of a robust health database is being spelled out at this gathering.
Am I capturing that?